All right, we've looked at macromolecules and then we've looked at the micromolecules. And now let's apply all of this to nutrition in different stages of life. And you'll find that there are some similarities between when you're growing up and when you're in your twilight years. Um, you'll find that some of the nutrient needs are the same, but for different reasons. So let's first look at um, nutrition in pregnancy. So let's look at some terms. We have the umbilical cord that contains all the blood vessels, and then the placenta that has all the nutrients, and that's also the gas exchange between the mother and the fetus. And then we have different terms for what we call a baby. So the first couple of weeks right after implantation is called a zygote. And then after a couple of weeks, from about 2 weeks until about 2 months, it's an embryo. So zygote for the first 2 weeks and an embryo, and then a fetus after um, after, did I say a couple of weeks? After a couple of months, from about 2 weeks to about 2 months is an embryo, and then after 2 months is a fetus. So there's these things called critical periods, and this is not mentioned in great detail in the book, but it's very important. So there's times in the baby's life that if you do some kind of damage, the fetus can get out of it. Right, some damage is done, but these are rapidly developing cells, and the baby can kind of fix itself, right? But there's things called critical periods where if damage is done, that's it, it's done. And every organ has different times, right? And so I gave the example here of the brain development, the critical period for the brain development when you do damage in this time, and it's rather early on, the damage to the brain, it's done. And we talked about two examples of these neural tube defects, anencephaly and spina bifida, that had to do with folic acid. Of course, it also has to do with like alcohol intake, like we talked about fetal alcohol syndrome. So let me make sure that I'm still on. I am. Okay. So yeah, that's because the critical period is kind of early, and sometimes people don't know that they're pregnant, and they keep on going like they were going before. So the weight of the mother, now these are averages, right? So there's always going to be exceptions, but in general, on average, the weight of the mother is going to affect the weight of the child. So underweight mothers tend to have preterm babies and babies that are lower in weight, and the reverse is true. That's a general trend. There's always exceptions. You might have those in your family, and yeah, that's true. Right. So, how much weight is expected to be gained in pregnancy? About 30 pounds. So you should, at the very, very, very least, gain 15 pounds, no matter what your weight is. Right. So, however, underweight women are going to be expected to gain a little more, and overweight women might gain a little bit less. And there's the reason for that is because of the distribution of that weight. And I've kind of listed some of it here. Your book has it listed perhaps slightly different, but it's about the same numbers, right? So you're going to have increased fat stores, because that's energy stores, and an increased blood supply. So that's about 7 pounds each. And then you have other fluids, synovial fluids and cerebrospinal fluid and stuff like that. All right, and then that's about 4 pounds. And then the baby itself is going to weigh 7 or 8 pounds. And then the increased weight of the breast and then the amniotic fluid and the uterus, those are each going to weigh a couple pounds. And then finally have your placenta that weighs about 1 pound to 2 pounds. So if you add all that up, you get somewhere around that 25-pound mark. Right? So how much, when does this weight get added on? Well, the first trimester, not a whole lot, just a few pounds, 3 to 4 pounds. Then it's roughly, on average, about 1 pound a week after that. So your energy needs are a lot different. Well, you know what? They're not a lot different. 340 calories a day in your second trimester, about 450 calories a day in your third trimester. It's a large fry at McDonald's difference. right? So I mean, I guess if you look at it that way, but you don't really have the option of eating less, right? So you should be getting more energy in you. But it's not just energy, it's about nutrients. So the first thing is proteins because we're all made from proteins. So if you're injured, what do you need to fix yourself? Proteins. If you're growing because you're a teenager, what do you need? Proteins. If you have a baby growing in you, what do you need as a mother? Proteins. So it's always going to be proteins, right? So about an extra 25 grams a day. So we're going from about 40 to about 65 grams, somewhere like that. Folic acid or folate. That's the other name for folic acid. Definitely the first vitamin. If you have to pick one vitamin to increase, you're going to increase folate. And so the RDA for that is only about 400 micrograms. So some studies are saying 4,000, so like 10 times the amount. That's how important folic acid is. Iron, you're going to have to increase iron. Oh, what is crawling? Go ahead. You're going to need to increase iron, obviously, because you have an increase in blood stores. Zinc, your book doesn't talk a lot about zinc, but you're going to need to significantly increase that. And then, of course, calcium, because you're increasing bone. A lot of pregnant mothers don't get outside as much, so there's that issue with vitamin D. And remember, vitamin D and calcium are linked. And so, go ahead. So, what are some nutritional problems that pregnant mothers might come across? Nausea. And you're going to see that for a lot of these things, there's not any answers, right? So, nausea, don't try to be careful with dehydration. Try to increase your fluid intake. Constipation, increase your fluid intake. Heartburn, increase your fluid intake. It's like, I would imagine that it would be horrible advice to get, but remember, there's reasons for that. Antacids can mess with like iron, so iron absorption, right? So there's reasons that you can't treat these problems the same way as you normally would. And so, what are some high risk factors in pregnancy? Well, BMI. So being too heavy or too light. So having a BMI of over 26 or so and under like around 18. It's essentially being too skinny or too fat. Age, being too young or too old. So that sweet spot, biologically speaking, is somewhere around like 19, 24, something like that. Around that age. But after you get 35, things start happening. It gets the pregnancies become more difficult. And of course, under 15, you're still developing as well. So a 15, 16, 17-year-old girl is still developing herself, and there's a baby developing. So smoking or drug use, obvious reasons. Number 3, low socioeconomic status, meaning it's not just being poor, it's being poor. So how do we apply this SES? How do we apply this with pregnancy? Being poor, hold on, make sure I'm still in. Being poor and not knowing where to get resources, not knowing that you need to see a doctor, and then maybe the doctor's like, well, he doesn't have any appointments for a month and a half. See, I was waiting for that. So yeah, low SES. It's not only money, but it's like, access to information and access to power and advocating for yourself, right? So somebody might say, oh, well, the doctor said a month and a half. It's a month and a half. I don't have health insurance, so that's it. I'm going to wait a month and a half. No, you go see another doctor, or you push to get in. So you know what I'm saying? That's why SES is up there at like number 3. Malnutrition, for obvious reasons. You're not getting enough energy. You're not getting enough nutrients. Having too many children back to back. And then having diabetes or hypertension, because there's gestational diabetes and there's gestational hypertension, meaning that you get temporary diabetes or temporary, like transient, temporary high blood pressure, but it goes away once the baby's born. But those are still risk factors, right? And then one of the things that we have to watch out for is preeclampsia, which is hypertension, but it's like a little bit worse. So there's hypertension, and then there's protein in the urine, and you're retaining water. And if you let that go untreated, it could develop into eclampsia, sorry, which is characterized by like seizures, and that's very serious. But they, typically it doesn't get to that point. So why is being like 15, 16, 17, why is that like a risk factor? Yeah, I put under 15, but really, young age is a risk factor because the young girls and boys tend to eat really bad. I mean, that's what it is. So there's a higher risk for anemia from iron deficiency, and so there's higher cases of like preterm births. Over 35, higher risk for, I'm giving you an example here, with Down syndrome. So at 35 years old, the incidence of Down syndrome was 1 in 300. At 20 years old, it's 1 in 10,000. So you see like the big difference, right? So that's like an example. Like I'm not saying that someone 35 shouldn't have a baby. I'm just saying that there's risk factors at that age. And what do you avoid? I've already talked about this a little bit. Alcohol, because it interferes with so many vitamins, but folic acid being the principal vitamin that it inhibits. So that's going to lead to fetal alcohol syndrome. But there's other vitamins too, like thiamine, for example, and soft cheeses, like those packaged meats, anything that has a chance of having listeria. That's the issue behind like soft cheeses and stuff. And then fish that you might not ever need, you might ever eat, but who knows? Like maybe if you're pregnant, you have like maybe you want to have mackerel, but fish. Too much fish that has you don't want to have too much. You don't want to introduce more mercury into your diet at this time. So there you go. That's nutrition in pregnancy. And in the next chapter, we're going to get into a little bit more like breast milk in the first years of the child's life.